Hi, my name is Nancy Gomez, and I'll be going through MRI's magnetic resonance imaging. I'll be going over the history, the use and risk, the studies, and what we can take away from this. The history. The gentleman right here to the right, his name is Isidore Isaac Rabi, also known as II Rabi. He set the foundation for MRIs. So he first learned he conducted experiments, I guess you can say, with the atomic nuclei with well-known physicists such as Arnold Sommerfeld, who was known for his theories of the atom. He set his eyes on the nuclear spin of the atom, by improving the molecular beam method lab, which he established at Cornell University in the United States. While he created this lab to try to find the nuclear spin of sodium, he actually ended up finding the accurate values of the spins of atoms, and that included hydrogen. This ended up being a foundation for the, and I quote, the magnetic resonance method, end quote, by Turkov. As Turkov stated, after there was a development for imaging in the 1970s, in which scientists used his magnetic resonance method, and by 1977, the first MRI was conducted on a human live subject. In the 1980s, the machines became publicly available. The use. The use of MRIs, according to the National Institute of Biomedical Imaging and Bioengineering, also known as NIH, an MRI is, and I quote, non-invasive imaging technology that produces three-dimensional detailed anatomical images, end quote. So MRIs, usually a patient needs to go into this mechanical tube, as pictured here to the left, in which their water molecules are realigned with the magnetism of the machine. This is how the images to the right are created, in which, you know, the brain, the spine, the central nervous system, and the different anatomies are portrayed through these images and help physicians determine a diagnosis and a prognosis. Patients. So according to Mayo Clinic, patients who have suffered from aneurysm, stroke, and brain injury, end quote, or have issues with their skeletal system to include their organ systems, usually have MRIs conducted. As previously stated, MRIs can be conducted on different anatomical structures. According to the Mayo Clinic, on their site, it actually provides very detailed examples on what an MRI can assess and and how detailed these images can be. So for example, the heart and blood vessels, and I'm quoting, size and function of the heart chambers can be assessed, thickness and movement of the walls of the heart, extent of damage caused by heart attacks, structural problems in the aorta such as aneurysms, inflammation or blockages in the blood vessels, end quote. It's just to name a few of what an MRI can do, or the images that they can take. MRIs can also find tumors. They provide extensive detail of our anatomy. However, there are repercussions. The risks include a strong magnetic field. Usually those with pacemakers or any metal in their body aren't allowed to be near the MRI area or in the MRI, as the strong magnetic field can actually hurt them. Other risks are contrast agents. Contrast agents will be talked about further in detail in the later slide, but let's just say contrast agents pose a risk for those with severe renal dysfunction and can and can cause NSF, which is nephrogenic system fibrosis. It causes skin-like disease symptoms, from my understanding. And the next risk is claustrophobia. MRIs are much longer than CTs, and usually those with anxiety, it can induce anxiety or panic attack symptoms in individuals. For that reason, technicians usually provide a panic button or emergency button. These images do take long. It can take mostly up to an hour, 45 minutes to an hour to take these images, but these are just a few of the risks. Okay, so the study of contrast agents. As I said before, contrast agents are a potential risk for those who have renal dysfunction, especially severe renal dysfunction or kidney dysfunction. CAs were actually first studied in 1984, and this was through the process of chelation. Chelation occurs when there is a bond to a metal atom in which it changes the chemistry of that element to become less toxic to humans. So chelation was first introduced in 1984, as I said, and this made it so MRIs could become clearer images. As I said, it didn't become public till the 1980s, so these contrast agents helped MRIs become clearer and helped physicians find tumors in the brain, or, as I said, lesions. However, FDA approval for these contrast agents didn't arrive till the 1988s, and the following GD and DTPA and Magnifis were the first to become approved. Nonetheless, in Minton's study, it says that these Magnifis and GD-DTPA, which he later calls GBCAs, a little confusing, but nonetheless, these actually ended up causing NSF in a lot of the patients who had renal dysfunction. And there was about 400 to 800 cases worldwide in which it caused NSF in individuals. So that ended up introducing a new market of GBCAs or contrast agents called microcyclic. They're divided into microcyclic and linear. Magnetivis ended up being linear, in which during chelation it enfolds around the ion, and microcyclic meaning that it confines the ion. So these are the microcyclic, the Prohance, and the Gatavist. Even though there was all these new types of GBCAs being put out in the market, some were stopped, or I guess you can say ceased from being used with those with renal dysfunctions, as the dosage affected the patients. It turns out that no matter if it was microcyclic or linear, there was and I quote, retention, end quote, of GBCAs in an individual's brain, and when conducting plasma mass spectrometry, it was found in the bones. So these GBCAs ended up being in the individual's body months or weeks later. However, the causes weren't known. So the GBCAs remained in the body, but it wasn't known on what the consequences were. So in Minton's study, she concluded that more studies needed to be conducted on the, and I quote, clinical consequences of GBCAs, as they are unknown, and there needs to be more studies on appropriate measures for those who have renal dysfunction or severe renal dysfunction, on what GBCAs can be used for them, because they have been, I know in some European agencies, they have been banned completely from those who have severe renal dysfunction. And so she says that more studies need to be conducted, as MRIs and contrast-enhanced MRIs are known to, and I quote, provide crucial life-saving medical information, end quote. As I said before, MRIs can find tumors, can find lesions in the body. Without these contrast agents, however, the images don't become as clear, and it's very difficult to find these medical analysis, I guess you can say, that can provide information to a physician on how prognosis should be or what treatments they should take. So again, there just needs to be more studies on GBCAs and how they affect people, and what type of new GBCAs can be done on those with poor renal function. So one of the conclusions that I can give for MRIs and for this study is that physicians and patients need to measure and balance the consequences and the benefits of an MRI being conducted with contrast agents. And thus that ends my slideshow, my presentation, and it's thanks to SlidesGo for this template, and these are my references. Thank you.